In 2001, African leaders converged on Abuja. The outcome of that convergence was what was later known as the Abuja Declaration, and that declaration was centered on the African leaders' commitment to allocate 15% of their annual budget to healthcare. But 23 years down the line, we are very far from achieving that vision. And that is going to form the center of our discussion today. But before we go further, we would like to go out and ask Nigerians, what is their perspective of healthcare and healthcare delivery in Nigeria?
Okay, good afternoon.
Please, may I meet you?
Yeah, my name is Rose Isaac.
Okay. Rose, I want to find out from you, what do you make of the current state of healthcare in Nigeria?
It's really difficult. In fact, going to the hospital sometimes, you meet a lot of challenges and you feel so discouraged. And I feel the best way is getting the normal herbs that we do get to take. Even as I'm talking to you, I'm not too strong, but I've gotten my herbs already. So it's really poor. The health-wise is the government don't even know about our existence.
Ni sunana Alhaji Saidu. Ni mutumin Kano ne amma yanzu ina nan Abuja Central area ina so da ya duka. To alhamdulillah wato harkar lafiya a kasan nan dangane da talaka sai dai a ce inna lillahi wa inna ilaihi raji'un. Domin kuwa ko da ana cewa ana ba da magani a asibiti, to ba za ka ganewa ba a bayarwa ba sai ka je. Sai ka je sannan ka gane cewar ba a bayarwa. Idan kuma ma ka je da 'yan kuɗin ka kaɗan ba za su ishe ka ba. Dama idan ka je ba kuɗi ma ko sauraron ka ba za a yi ba a gaskiyar lamari duka asibitocin nan.
Good afternoon, sir.
Please, may I meet you?
My name is Mr. Emmanuel Efiong. Well, it's in a deplorable condition. You know, it's a far cry from what it used to be, because it seems as if it's getting worse and worse every day, and something needs to be done.
What needs to be done?
Well, I think policy failure. We are only good at setting policies, but we are not good at implementing and following these policies.
Please, may I meet you?
I am Mrs. Badesta Osweke. I'll say from my own experience, because I have an aged mother I'm taking care of. For me personally, we go through HMO, so which is a little bit easier for us working. But for those that is not working, there is no really. I would say there are some HMOs that also attend to private individuals. But from my own experience, we use the National Hospital here in Abuja. It's not been easy because most of the time the cost of drugs, and again sometimes the doctor's availability, it's not been easy because trying to manage a patient who has an healthcare challenge, sometimes availability of drugs can be difficult, and sometimes the daily, how do I put it, different expenses for you to see a doctor. You need to pay for some there's some routine you need to go through for you to get access to see your doctor. So I feel the government needs to come in to enable citizens have a better life through providing sometimes free healthcare.
Come back from the Vox Pop. We have heard from the Nigerians. We have seen their perspective on healthcare. I would now like to hand you over to the Executive Secretary of the Organization of Trade Unions of West Africa, OTUWA, who will be telling us about the organization and the campaigns that are ongoing on healthcare is a human right?
My name is John Oda. I work with the Organization of Trade Unions of West Africa as the Executive Secretary.
Okay, sir, I would like to know a little bit more about the organization. What is it about? What do you do?
The Organization of Trade Unions of West Africa is the sub-regional trade union center bringing together all the national trade unions of the 15 countries that make up the economic community of West African states. So the Nigeria Labour Congress is the biggest affiliate, obviously, as the biggest trade union center in the African continent. It's also the biggest in West Africa. And then, of course, the TUC. So these are the Nigerian affiliates of OTUWA.
Thank you very much, sir. So we'd like to know, you have been in collaboration with the American Solidarity Center since 2020, working around the issue of healthcare as a human right. We'd like to know what kind of impact has this campaign made at the sub-regional and the national level. What is your take on the issue of healthcare looking at the sub-region?
Okay, actually in 2019, just before the outbreak of COVID-19, we had a workshop with the Solidarity Center to try to map out the area that we wanted to do a long-term collaboration on. And the workshop, we brought people from around the West African sub-region, decided that we should take the theme of health is a human right. And the second workshop that we had was in March. And this was just before the outbreak of COVID-19. So it just by some providence that the thematic area we decided to work on also became very important since COVID-19 led to the shutdown of virtually all activities around the globe. So we first then decided to look at how the countries of the West African sub-region were addressing this very problematic pandemic. And we did a survey in 6 countries of the sub-region and presented the report how the healthcare workers who were the front line in the campaign against to try to bring about the healthy resolution to the pandemic, how they were faring. And we discovered that they were doing an incredible job since a number of them didn't have any protective equipment, and still yet they still tried to manage as best as they could to protect life and to help those who had already been affected by this pandemic. So that was the first thing we did, and we then did a number of recommendations which we sent to ECOWAS, that there was a need for them to do more in terms of what was being done to address the pandemic. I must say that West Africa, more than the other regions in the African continent, were more prepared because we had the Ebola virus crisis a few years earlier, and the steps that were taken to address this. As soon as the pandemic was declared a worldwide problem, the West African Health Organization, which is an agency of ECOWAS, went into full gear and bought a number of drugs and equipment and distributed to the 15 countries of the West African sub-region. the other sub-region had to scamper to try and meet this type of provisions. And then in the second year, this was in 2020, in the second year we then did another round of survey as to how the people in the informal sector, which in our sub-region constitutes between 70 and 80% of the workforce, how they are impacted by the pandemics and how the countries of the sub-region were treating these people in the informal sector who are not in the public service. And we discovered that the situation was really very bad, and then we made a number of recommendations to the national authorities and to ECOWAS on the need to extend healthcare to this very vulnerable sector of the.
So we are aware that looking at the social dialogue setting, we know that the government, employers, and then the workers are supposed to be working together on issues like this. We want to know if there are existing collaboration of these three important figures, and also if this collaboration is yielding the kind of returns that we should expect in the health sector. And if not, what needs to be done? What's the way forward to be able to ensure that healthcare across the sub-region is affordable, is accessible, and is available?
Okay, I think broadly one can say that there is a bipartite relationship that exists, which is well functioning. But if by bipartite I mean that government and workers who are organized within the health sector, whether as medical and health, whether as nurses and midwife, or whether as medical doctors or pharmacists, as the case may be. This an organizational relationship, and there is constant dialogue that's going on. Whether the government at both the sub-regional level and at the national level take all that the social partners recommend is a different ball game. But whether there has been a very coherent relationship in terms of the social partners plus, and by social partners plus I mean apart from workers, government and employers, the rest of civil society, in this case those who work within the health sector, whether they've been an organic relationship, I'm not very sure that this has been very effective. But we do recognize as a core part of civil society, at organized level, that these other players, that is the NGOs within the health sector, also play a very important role. And in terms of the campaigns that we do, in this particular campaign, which is into its 4th year now, we've made strenuous efforts to incorporate civil society into it.
That was the Executive Secretary of the Organization of Trade Unions of West Africa, OTUWA. Now we're going to have a guest join us, and this guest is a health practitioner who will be giving us her perspective on healthcare delivery infrastructure in Nigeria. And my guest this moment is Nanman Cash. You're welcome to the program.
Thank you for having me.
And you look beautiful.
Oh, thank you. And you too look so beautiful.
Thank you. So, Nanman, coming out of the Vox Pop, we've heard from Nigerians. It seems like we have serious concerns about the health sector. But I want to hear from you as a health practitioner. What is your idea or what's your assessment of the healthcare infrastructure and all of that in Nigeria?
Okay, thank you once more. The healthcare infrastructure of Nigeria. Well, before I even go into the infrastructure, Nigeria is blessed. And even the healthcare sector is so blessed. We have a population that is so impressive. We have a lot of women, we have young people who are energetic, we have children, and we still have women giving birth if you go to the antenatal unit. So we have a very good population that if we have a healthy population, it shows that Nigeria is going to be a highly productive country. So talking about the infrastructure of Nigeria healthcare system, well, I think COVID was the litmus test that really gave us a shocker. When COVID came, the infrastructure in the hospital wasn't really so impressive that I thought that by now the infrastructure of Nigerian healthcare should be something that we'll be happy about, because nobody could travel out. The elites were part of the casualties or people who were affected by COVID. But look at us. This is about 4 years after COVID. We still have issues with infrastructure in the Nigeria healthcare system.
Okay, we are having more of the Japa syndrome in the health sector. And this is resulting in very low number of doctors, nurses that people can access for healthcare. We also have the issue of proliferation of fake drugs, quackery, and all of that. I would like to know, these challenges, where do we go from here? How do we address it? How do we, looking at the commitment of African leaders in 2001 on the 15% allocation of their annual budgets to healthcare. Looking at what is real now, well, we are far from that 15%. What do you think we should be doing?
Okay, looking at these challenges and talking about the Japa syndrome, where healthcare workers are leaving the shores of Nigeria to go seek for better conditions or greener pastures, as we always say, is that let's look at the pulling factors and the pushing factors. What do I mean by that? Is that our healthcare workers, what is really pulling them to that side? There are things. What are the remuneration of the healthcare worker here? Example, as a nurse, how much are they paying a nurse in Nigeria and how much are they paying a nurse out there in the other countries? That could pull somebody because their remuneration is better off out there than this place. Talking of the infrastructure that we talk about, there's nothing as frustrating for a health worker like you want to do a certain procedure. A patient is looking up to you to render healthcare and you don't have what to work with. So it means that you can't even help the person and the patient might not understand. So infrastructural issues is another issue that is making some health workers to leave the shores of Nigeria. So we should look at all those things. Now, what are the things pushing some of them aside the remuneration, the infrastructure? Insecurity is another thing. Healthcare workers are being kidnapped, some were attacked on their way to work, and it's still happening. So, but out there it's not so. They honor health workers. Health workers are well treated. I spoke about the healthcare system in Nigeria, and I said we have a robust healthcare system because if you go out there, the health workers you meet out there are Nigerians. Then talking about our people going for medical tourism, they leave Nigeria, go to all those other countries. The doctors, the nurses, and the other healthcare workers mostly are Nigerians or Africans out there. That shows that we have the institutions that train our health workers well. But how do we keep these health workers to render these quality services to our people? That's a major thing. Now we're talking about the economy, the relationship between health and wealth now. If the money taken out of Nigeria to go treat our elites out there is being invested back into Nigeria, can you just imagine our healthcare system would be? It would be bigger and better. Now I'm talking about the declaration, the 2001 Abuja declaration, where we said, where we our leaders, the African leaders, converged in Abuja and all made a commitment that they'll allocate 15% of their annual budgets to healthcare. But this is 2014, about 23 years down the line.
24.
Okay, almost 24 years now.
2024.
2001, this is 2024.
Yes.
Now, nothing is done that way. The 2024 budget was less than 5%, and we're talking about 15%. So I think a lot needs to be done, because for a budget to be less than 5% in a sector that is essential to the well-being of citizens, to the productivity of the citizens, and to the outcome of wealth of that nation, I think it is time for government to look into the healthcare system and understand that it is worth that 15% at least.
Thank you, Nanman. I was just, as you were talking, I was wondering, so do we leave this to the government? Is there any other way that stakeholders can, should, will come together to work together to ensure that our health system becomes the ideal? Because I know that back in the days, people were actually coming to Nigeria to access healthcare. But today, it is in the reverse. So what do we as stakeholders, civil society organizations, government, agencies, name it, how do we come together to make it happen?
A lot needs to be done. I think we're all stakeholders in this. It is not just government. Government has her role. We, the citizens, have our role. Healthcare managers or leaders or people who are in the helm of affairs of health, like if you're the MD, you're the director, whoever is whatever is the title, everybody has a responsibility. To the government, investment in healthcare, like we talked about the budget, it shouldn't be less than 5% like it is being captured in 2024. That 15% that our leaders made that commitment, government should look into that. That is one side. Now, in the healthcare sector itself, even if these resources are allocated, how do we monitor this? How do we understand that corruption won't swallow up these resources that enter it? So that's another thing. So who are the managers of healthcare? They have a responsibility to understand, to ensure that resources are maximized. Resources are allocated to where it is supposed to be. Not that the budget says, this is for training. You now carry it and do another thing. Or they say, this is to buy equipment. You now pick it and say, no, we need to build another thing. No. Allocation of resources by people who are managers or people who are in the helm of affairs of the healthcare system matters a lot. Then to we, the healthcare workers, we also have a role. If I am committed to render care, I have a duty of care to my clients, I should do my best. And then how do we educate these patients? I have a responsibility. The healthcare workers have a responsibility to educate the patients, to understand what is happening in the system, what is happening with their own health, and what they need to know, what they need to do part-time. So everybody must be on deck. Now the civil society, now organizations like OTUWA now is campaigning that health is human right, and that is the truth. Health is a human right, and you are calling on government, calling on everybody to take responsibility, and that is the key word. Pressure groups must come up, CSOs must come up and remind government of her responsibility to the citizens of the country, that they owe Nigerians quality health care.
Thank you so much, Nana. It's been a wonderful and insightful conversation with you, and thank you so much for your time.
Thank you.
So, we've heard from the health practitioner herself, and I'm particularly interested in the way forward. She has been able to enumerate certain steps that can be taken by way of going forward to improve our health sector. I'm hoping that the government is listening and all parties involved are listening, and hopefully in the nearest future, Nigerians will be able to smile in terms of access to proper healthcare, affordable healthcare. Thank you so much for joining me. Till next time, my name remains Precious Ilat. Bye for now.